Good morning. This is Dana Parsons with LeadingAge Virginia. Thank you so much for joining our coronavirus weekly member update call. Before we get started, I just wanted to let you all know to be on the lookout for an educational series that we're going to be providing from a legal perspective as the state begins to open and questions come up regarding communities opening and so forth, which will be a topic of our discussion today. We are going to be offering a series of webinars with CEUs to help get you prepared from a liability standpoint, to help you prepare for all the things that you would need to protect yourself from any type of legal issues that may arise once COVID is no longer a situation. So wanted to let you all know that, and I'm happy to introduce Kathy Peterson from the Department of Social Services, who is going to address a few issues regarding reporting and so forth. So thank you for joining us today, Kathy. Okay, Kathy, are you with us? You'll need to unmute yourself, and that could be *6.
There we go.
Okay,
Good
great. Well,
morning.
thank you, Kathy, for joining us.
Thank you for having me. I just want to go over a couple of things regarding the May 6th memo that went out regarding PPE distribution and the information we are collecting from the assisted living facilities. I know that there has been some questions regarding if you were to report, such as the nursing homes are, to the CDC and going through VDH. Our process is a little different, as we pointed out. We are actually working through VDEM. We are strongly encouraging all facilities to report on a weekly basis by close of business on Tuesdays. And this is really to help our folks in the field and in the facilities. This is to determine a baseline for their burn rate and for their inventory in the event that they have an outbreak in their facility, or if they have an unplanned supply chain issue, or if they are entering a critical shortage, which is defined as a 7-day or fewer available days of PPE. So it's really important to be reporting. This is not mandated. We are not federally mandated, so that's why obviously we're not going through CMS or through VDH. So it is a bit different. It's a different reporting mechanism and platform than VDH is using. We will, like I said, we're working through VDEM, and we will be obtaining all of the PPE and distributing that to those that are in an urgent need situation, or that VDEM determines through their reporting are entering into a critical shortage of their PPE based on what they report.
So thank you, Kathy. So just to clarify, the reporting regarding PPE is voluntary and not mandatory, and
Correct.
the Department of Social Services is not requiring that assisted livings in Virginia report according to the new CDC requirements. As I had mentioned to you earlier this morning, the CDC is being very aggressive and reaching out to assisted livings and asking them to report, but that is not a requirement. Is that correct?
That is correct. We, at this time, we are not, we can't mandate that. We strongly encourage that. And, we're doing this to help the people in the field, so that they have adequate supplies in the event that they need that, if there's an outbreak or an unplanned shortage.
Okay, great. Well, do we have any questions? Yes, we do. Would we be able to forward the burn rate calculator weekly instead of filling out the web form, and where to send it?
We are asking everyone to report via the link that went out in the memo, the May 6th memo. And the reason for that is that's being monitored by VDEM and by VDSS. And VDEM is calculating the burn rate. They're doing all of the hard work, as far as the calculations and everything to monitor that. And so that we really request and encourage that you use the link provided in the memo.
Okay, and is that weekly, or how often are you requiring that?
Yes, we are. We are encouraging everyone to
I'm
report that on a
sorry,
weekly,
encouraging.
right? Um, but on a weekly basis by the close of business each Tuesday. And when you report that by the close of business each Tuesday, the drop will be made through VDEM the following week. So essentially, we're working a week behind. Once you report, then we will get that distribution to you the week after that. We will be sending out information if you have an urgent need, and you have an emergency and you're really short on your supplies. We can help working alongside with the local Department of Health to provide you with any supplies that you may need in the event that there is an emergency.
We did receive a comment that communities are tracking based on their burn rate by box and case, and that the format that you all have wants individual items, which takes up significant time. So I guess the question would be, is there um, any way that that might be modified to be more efficient? And then a second question is, can that be reported corporately? So for those assisted livings that have numerous assisted livings under a corporation, could that be reported in an aggregate manner?
Okay. So answer the first question. And well, I'll answer the second question. We're asking that each facility report individually, and that is because if there is a need that arises, we will cater to that facility specifically, not on a corporate level. So that was outlined as well in the memo, and you know that's kind of hard for some folks, but if they can do that, that's what we are really requesting. And I'm sorry, what was the first question?
That the formatting is difficult.
Okay.
Communities are tracking based on the
Right.
burn rate by box and case, and the DSS format wants individual items, which is taking up significant time
Right.
for them to complete. Is it possible that that form could be made more efficient?
Yeah, if you can get that information to me, I'll forward that on to VDEM. They are the creator of the survey,
Okay.
and I can pass that on to them as a request, from our providers, and we can see what we can do.
Okay, great. Are there any more questions for Kathy? And I just want to clarify again, just because we've been getting so many questions today, that if our assisted living members are contacted by the CDC to report, they are not required to. They could do so voluntarily. And so we will have a nursing home update later in the call, and we can talk a little bit more about how to respond to the CDC when those requests are made. But I just wanted to reiterate that that's just a voluntary option and not required by Virginia.
Correct.
So thank you, Kathy. We really appreciate. If you'd love to stay on for the entire call, we'd love to have you. We know you're really busy, but we really appreciate you joining us today. And we'll get that information to you about the form to pass along to VDEM. So thank you so much for all that you're doing for us. Thank you.
Thank you for having me.
I'd like to pass it along to Kelly Parker now, who is going to give a Virginia Hospital and Healthcare Association update, including updates regarding PPE distributions to nursing homes. So over to you, Kelly.
Great, thank you, Dana. Can you hear me all right?
Yes.
Awesome. Thank
We
you
can.
very much. Good morning, everyone. Just to provide some brief updates from our Virginia Healthcare Emergency Management Program and the work of our coalition. Our coalitions continue to work with the skilled nursing facilities and the state to obtain PPE from the state's cache and then distribute to the facilities that are in need of PPE. As of about 2 days ago, we have a total of 574 independent distributions to skilled nursing facilities across Virginia from our healthcare coalition, and that is since March 18th. Of that distribution, roughly 110,095 have been distributed, over 166,000 surgical masks, almost 30,000 gowns, just over 20,000 face shields, 28,000 gloves, and just over 24,000 shoe covers. And that varies, depends on the request that has been made or the needs within each facility and within region, as well as the availability of supplies. Our healthcare coalitions continue to place orders with the state. We do realize and would like to reemphasize that the amount of supplies that are being received are not anywhere near the amount of supplies that are needed to fulfill everybody's needs. And so we wanted to also reiterate that PPE distribution by the state and by healthcare coalitions is the last resort option for PPE for any healthcare facility. And so there will be a lot of work being done to ensure that facilities have exhausted all of their supply chain efforts, as well as have done everything they can to exhaust leveraging relationships or existing relationships with other facilities or corporate entities. And the coalitions will really be working with the facilities to ensure that they can find an equitable and sustainable PPE distribution channel. The supplies that our coalitions receive do vary. So, we might have a large number of surgical masks and not as many gowns, which I know are the big issue right now. But they are working with the supplies that they are able to get their hands on through the state. We are in the process of finalizing a kind of newer request process for PPE, and it mirrors the same process that our hospitals use to submit information to the healthcare coalitions, and it will be a combination of continuing to submit the needs through our VHOS system, as well as an additional form called kind of a modified 213RR form, which is used in the emergency management world. We're finalizing those policies and procedures with LeadingAge and with our healthcare coalitions right now, and as soon as those are finalized, we will ensure to send out to all of you through the associations. We will send it out to our VHOS listserv. We will send it out to our healthcare coalitions to distribute. So expect to see that probably coming from a couple of different channels here within the next few days. The other thing that I would like to kind of update on is our Russell Phillips project and the Russell Phillips and Associates group that we contracted with to kind of just help bridge some of the gaps and meet some of the needs that you are experiencing within your facilities. We had some really great kind of listening sessions within the region last week, and they were between members that were identified through VHCA and LeadingAge, as well as from our hospitals, folks who have an increased engagement with the long-term care community. And what we really wanted to do was just kind of hear what some of the short-term and long-term challenges are going to be, and we know a lot of the short-term challenges, but also trying to plan and prepare for what the long-term implications and challenges are and how we can best support and address those through collaborative partnerships with the resources that are available in each region. we had some really robust discussion. There was a lot of commonalities. Obviously, staffing and testing are a big issue, and those are things that are being addressed in various work groups. But there were also a lot of consistencies in terms of what some of the needs are from the skilled nursing facilities, and this includes availability of fit testing, routine guidance, information, and training on isolation versus quarantine and how best to accomplish that in each facility, guidance and training on PPE conservation and reuse, given the resources that are available in each region, and resources on donning and doffing of PPE. Additionally, there was increased questions regarding which facilities are able and willing to take COVID residents, which ones have the resources to do so, which would like to have the resources to do so or build out that capability but aren't quite there yet. So we're working with that team to kind of compile all of this information and figure out how we can best address some of these issues and make the most impact. And then we'll be circling back around to all the facilities within the regions and the coalitions and our regional partners to really determine how we can make these actionable. So I do anticipate kind of more information coming out on that within the next week or so once we kind of get a good scope of work developed, and then expect to be working through our healthcare coalitions with you all at the local and regional level. Dana, I think that's all I had in terms of an update. I'd be happy to answer any questions or provide any additional information that I may have missed.
Dana, are you going to ask your question?
Sure, absolutely. Thank you so much, Kelly. So when the original PPE distribution list was released, there were some long-term care communities that should have been included that were not, and that we have passed that information on to you all. Can you provide an update if they've been added to the distribution list?
Yes, so I actually just received a response back from the state this morning, and I believe you're referencing the FEMA distribution that is going to facilities.
Yes, I am. I apologize for not clarifying that.
No problem. I just wanted to make sure that's what I was referencing. So I received information from the state in terms of how that should be communicated and what the facility needs to do, and it involves reaching out to, I believe, the regional CMS offices. And so, Dana, I'll touch base with you, I guess, after this call, just to make sure that I provide the appropriate information. But essentially, they said that the facility will need to contact HHS CMS. And so I'm not entirely sure what the best process of that would be. You all might know, but that's what I received this morning.
Okay, I was thinking that the best process would be that if a nursing home was not included in the original FEMA PPE distribution list, that they would let their regional healthcare coalition know.
Yeah, so essentially, if they weren't included in the FEMA distribution, if they let the regional healthcare coalition know, that request would come right back up to me, and we would in turn send it right back to the state. And so I was coordinating with the Office of Emergency Preparedness, who's been part of Unified Command, and with the VEST and VDEM, and that's what their suggestion was to reach back out to CMS from the facility level.
Okay, great.
And that's what I said. I think I can work with you on some of that, because I'm not sure if that's normal or routine communication that facilities have with CMS. Mm-hmm. But I'd be happy to help work through some of that.
Okay, great. We appreciate that. So we'll check in and see where our members are on that, and then you and I can work together. Are there any other questions for Kelly?
None in the chat box.
Okay, well, thanks so much, Kelly, for the update. We appreciate it, and I know you and I will be talking all later today and throughout the week. So thank you so much for all that you're doing for us. We really appreciate it. So over to Sarah Lineberger with the Virginia Department of Health to give us an update.
Hi, Dana. This is Carol Jamerson. Sarah had a competing call and asked me if I could step in and make a few announcements. So
great. Thank you.
Sure. Good morning to everyone. Just as a reminder, the governor, of course, established the long-term care task force on April 10th, and just want to review that The topics at hand were to ensure that all long-term care facilities have the resources they need to combat COVID-19, work to strengthen staffing, testing, and infection control measures as long-term care facilities, and keep our stakeholders informed about the impact of COVID-19 on long-term care facilities. So a big part of that was to make sure that we had one place for communication, that communication was clear, that guidance documents were posted in an easy-to-find location, and were updated as needed with as changes come along. So just as a reminder, now if you go to the vdh.virginia.gov coronavirus site, you'll find a section that says healthcare professions on the left-hand side. And if you open that, there's a link for long-term care, and then you come to the task force site. On the task force site now is the playbook. So the long-term care facility task force playbook is available and is a shortened sort of snapshot version of particular documents that we think are helpful, and they speak to all types of things, including the Virginia National Guard and testing, PPE, infection control, care transitions, communication, and give additional resources and references. So one thing that is going to be changed or added today is their point prevalence survey guidance. So this will be an additional document to the May 6th document that's already posted. This will include some results planning for long-term care facilities and what to do with those results. So that will be a new resource. When you eventually, when you get to that tab, you'll see that there will be two documents, and we just want you to be aware of the new one that's being posted. Also on our Virginia Department of Health website, of course, you know, there are daily case counts, and the death results from the previous day, or the total amount, is posted on that site. There are multiple layers to looking at that information now, and hopefully that will be helpful to everyone. And there are several sort of webinars that you can watch that speak. Dr. Oliver, for instance, is one of the webinars that you can watch just to get kind of quick updates. So we're trying to really make this website more user-friendly and listen to the people that have responded, saying what they'd like to see on it. And we hope, you know, to hear from you all if you find that this new site, this new link, this new look is helpful. And if not, if you have suggestions, please pass it on to us, because we want it to be a living, usable document for all of you.
Well, thank you so much. We will definitely be sure to include the updated PPS documents in our update today. I know that a question that I receive from time to time is this a voluntary process? So I just, while everyone's on the phone, wondered if you could reiterate that communities are not mandated to conduct the PPS if they choose not to.
Correct. So on that May 6th document, that's the very last question, I think, on the page, and it says, is a PPS required? And the answer is no. A facility can opt out of a PPS.
Another question is, with the Vice President's announcement this week that all nursing home residents should be tested for COVID, just wondering if VDH has started having conversations about that recommendation.
Not to my knowledge, but that doesn't mean it hasn't happened. I tend to do more on the infection control and prevention side than the testing side. I'll be happy to reach out and ask that question, and Dana, get back to you with an answer.
That would be great. I think that if that issue could be added to the governor's long-term care task force that we serve on as a discussion item would be great. If you wouldn't mind also making that recommendation.
Sure, I'll be happy to pass that on.
Well,
No more
thank you.
questions.
Thanks, Melissa. Well, thank you so much for joining us today and providing us with an update. Thank you so much for filling in with Sarah. That was great. Hope you can stay on, but we understand if you may have to leave, as we know everyone is so busy these days.
Thanks,
Moving on.
Dana.
Moving on to the next topic, I wanted to mention, and I'm pleased and delighted that we have Dee Percoin on from LeadingAge National to kind of give us a perspective on admissions and reopening. I wanted to say and to let everybody know on the phone that I've received a lot of questions from members about how other members are handling this. So we're going to be compiling a survey of questions and then send that out, and we will then take that information and compile that without any community identifying information. But just be on the lookout for that. If you have specific questions that you'd like to have included in that survey, shoot them to me as we develop it. So we want to just that question has been being asked a lot lately, and so we thought that a survey might be the best way to go. So with that said, I'd like to move on to Dee talking with us about her perspective on admissions to communities, especially that have had COVID outbreaks and those resolved. And then as we look at the issue of reopening from an independent living perspective. So over to you, Dee. Thanks so much for joining us.
Thank you, Dana, and good morning, everyone. And first of all, I always like to start by saying thank you to each and every one of you, as well as all of your team members who are working so hard to try to protect the people we serve and try to deal with this ever-evolving challenge of COVID-19. I know it's been long days and long weeks, and so thank you first and foremost for all you're doing. Yes, I am going to share with you what I'm hearing from members across the country. As you can imagine, a lot of folks are asking similar questions and looking for answers exactly in the way that you are. And for especially independent living, but also assisted living, it can be kind of tough to find a one-stop-all resource. And similar to what Dana just mentioned, I'm working on putting together a grouping of what are different members doing on various topics, and when it comes to reopening, you know, what are they considering doing with their either on-site amenities, with moves, which we'll talk about today, and admissions. And so, you know, starting with that, in Virginia, I'm going to just put a link in the chat box that may be helpful. Some of you may have already looked at this, but Dana did send over a question about admissions into assisted living, which quite honestly, first of all, this varies so much state by state that it's really hard to pin down one particular best practice. And secondly, even in Virginia, as Dana had observed also, it's a little bit of a treasure hunt trying to find something tangible. So what I just put in the chat box may be helpful to you. It's from the Virginia Department of Health, and it does on page 2 reference a few bullets around admissions. It's not a whole lot to go on, but at least it's something. So one, it says, do not admit any person who is ill. Another says, if possible, consider quarantining all new intakes for 14 days before they enter a facility's general population. And there's more there that you can read. So again, this is from the Virginia Department of Health, and it is interim guidance for group congregate residential program settings. So it doesn't specifically say assisted living, but it might be something that you can draw some, you know, resource from. As I know that a lot of times you're directed towards your Department of Health anyway when it comes to looking for guidelines for assisted living. To be honest with you, members that I have spoken with that presently have COVID-19 in their communities, a fair number of them have continued to suspend moves in to independent living or assisted living. And, something else to consider is just like in Virginia, across the country, folks are really struggling with testing supplies and not only having tests on one time, but on a frequent enough interval so that you can know on an ongoing basis what your community COVID-19 population might be. And so many people are asymptomatic. So really, until we have adequate testing to know, it may almost be impossible to know for sure that you have no more COVID-19 in your community. In fact, one member observed to me yesterday, she said, until we have testing, and once it happens, we're probably going to find a whole host of additional cases that we were completely unaware of because people are asymptomatic. So again, that's why LeadingAge is advocating so hard for testing and supplies and prioritization of aging services. So hopefully that is helpful to you. And, as I hear other things from other members specifically around that, I will absolutely share that. But for now, when it comes to moves and admissions, if you've had cases of COVID-19, a fair number of members that I've heard from have just continued to suspend moves into independent living or assisted living. Moving on to just reopening in general, and it's a huge topic and it's a very hot topic, as you all know. I've had conversations in many different states with members about what they're doing and putting that together into sort of a compendium of common practices. First and foremost, it's really important to know what's happening in your state. And I will now put into the chat box, you may have already seen this as well, but in Virginia, it's called Forward Virginia, and they have broken down by industry guidelines for reopening. Of course, none of this particularly or specifically focuses on aging services. What language I've been able to find in Virginia so far is that they say related to nursing homes to continue to restrict or eliminate visitors and the use of volunteers to minimize the risk of introducing the virus. So, keep going back to your Virginia website and checking that and seeing what else they put forward as Virginia continues to evolve its plan for reopening. But first and foremost, going back to the state language, a lot of members are creating a strategic plan for reopening, and I have a couple examples that are shareable, one from specifically a Village on the Isle in Florida that they've given us permission to share, so I'll be happy to send that over so you can take a look at it. But a lot of the strategic planning is figuring out different scenarios. Members have talked very broadly about this, trying to be realistic that we could liberalize some things now, like travel on and off campus or community amenities, but if we have another surge in cases in our community or within our own campus, then we might have to lock down or restrict movement again of people on campus. And one of the most important things I've heard a lot of different members stress is working very closely with residents, resident councils, resident leadership, or other resident representatives you may have, and really being very transparent, keeping them informed, including them in some of the decision making, and ideally having their help and buy-in in working with their peers. I had a very good conversation yesterday. My colleague Joe and I talked to a couple board members from NACRA, the National Association of Continuing Care Residents, and very interesting conversation about what's going on their campuses, and honestly heard a lot of support on the necessity to consider the common good, work together with management and, try to understand why, the world around us might be opening up a little bit more, but on our campus, we might have different restrictions because we are a special population. So that was a really interesting, good conversation and one that we are continuing to have. Talking about campus amenities. I'm going to put some links in the chat for your reference. Again, not necessarily saying they're the only way to do it or the way you want to do it, but these have been shared by other members as points of reference. When it comes to campus reopenings, I've heard members talk about primarily one or two approaches. One would be allowing residents, especially IL residents, to come and go on campus and not have to self-quarantine when they return any longer, but keeping on-site, on-campus amenities closed. That's one approach. Or another approach I've heard a lot of members talk about is not allowing that coming and going on campus yet, but opening up some community-based amenities like the pool, fitness center, outdoor spaces, and so on. And so if you're interested in that, or if that's something you're considering, and in a second, I'm going to post some links that you can take a look. A lot of conversation has been around the dining room and what to do. Of course, so many of our members are already delivering meals, doing grocery deliveries, and other types of sundry items. And some are considering expanding these services and not reopening their dining rooms because of that, risk of community spread and contagion. But others are considering reopening their dining rooms. And one member in particular offered the National Restaurant Association guidelines as a possible go-to resource if that's something you're thinking about doing. Looking at pools and fitness centers, similar conversations there. Many had already closed their pools or fitness centers. Some, like in Florida, actually kept theirs open but scheduled tea times as if it was a golf course where individuals could use the space for just them, and then a staff member would be there to clean and disinfect in between. Something you might consider doing if you're looking at liberalizing that space. And in a moment, I'll post, the CDC does have some guidelines for the operation of aquatic centers and other fitness-related facilities during COVID-19. There's a few other points we could talk about. I know I'm trying to watch the time, so I won't get into a lot of detail, but hair salons are another big point of conversation. Outdoor spaces, as a way to open up some space on campus. That's what some members are doing to try to offer a bit of a compromise as people are starting to get cabin fever. I'm going to jump over to new moves into campus, which kind of brings us right back along to where we started, because there have been, again, a lot of questions about moves in and out, whether or not the campus has had COVID-19, of course, is a factor. A lot of members, regardless, had already suspended a lot of their moves, or new residents themselves did not want to move in or took themselves off the wait list, or, and so folks have been watching this very, very carefully. As we all know, this has a big effect on our ongoing financial solvency. At some point, you need to have those entrance fees or move-in fees or down payments or whatever you may call them in order to keep that financial engine going. So folks are starting to tackle this question of when do we or should we start moves in again, and that could be into independent living, assisted living as well. So what I've seen with folks in this area, a couple members, and I'm asking if they can share their strategic plans for this, have come up with very specific, thorough plans for moves. And this can be very structured. One member in particular described, they have a certain time period where the incoming resident has to pack up their stuff, and then it sits for 3 to 5 days to let the virus hopefully degrade on whatever materials it's on surface-wise. And then their furniture and whatnot arrives to campus, and they have a holding area where they keep it again for another 3 to 5 days. Then the new people move in, and then they're immediately self-quarantined. That's one approach, and that's what one member is doing. Another has permitted moves, and since most of their building was already pretty much self-isolating, they permit the move to come in, and one family member can come in and help with unpacking, and then they encourage that person to stay at home, and they bring meals, resources, and other things to that new resident so that they can hopefully stay safely at home. So those are just a few suggestions and ideas that I'm hearing from members. I'm gathering them from all over the place, trying to create a different sort of patchwork quilt of, ideas that members are willing to share so that we can be learning from one another. So now I'm just going to pop those links into the chat box for you if you want to read more. I'm also going to include CDC has guidelines for AL and independent living. Again, you probably have read these already, but always good to go back and recheck those because they do update them periodically. And of course, that's something that here at LeadingAge we monitor very closely as well. It's a pleasure to talk with you all. Please, if you have questions, don't hesitate to reach out, and hopefully I'll get the opportunity to talk with you all again soon. So I'll go back to you, Dana.
Thank you so
Actually,
much. Yes,
I have a
Melissa.
question. Hey, Dee, it's Melissa. I have a question that came in the chat box. Have you heard from other communities around the country if there's any move to allow tested family to visit or to test family?
That is a great question and not something I've heard about. So I will start to ask as I'm on with other members and other calls in terms of visitation. And so one of the things I'm working on, and this is what I've more often heard from members, is what if we decide that right now we still don't want to permit visitors on campus? How do we handle that with the SNF, with the nursing home? It's a little bit more cut and dry, of course, because we have that really crisp CMS guidance. So what I've been working on state by state is pulling out language related to older adults, vulnerable individuals, and folks with chronic medical conditions, and what is the language for each state saying about the advice for those special populations. And so I'm putting that together as a resource. But I have not heard folks ask that yet about testing families. Of course, the biggest concern is, do we have enough tests right now for residents and for staff? And I know that's just like in Virginia, it's everywhere. The biggest concern is getting enough supplies right now for that. At some point, expanding that to families, I think is an interesting consideration, and I will definitely inquire.
Yeah, thank you. I mean, we know that testing continues to be a challenge in Virginia. And so, that would be a challenge because right now our members are just trying to get tests so that they can test their residents and staff, as you said. And then there's another comment in the chat box that families can be asymptomatic carriers. So it's a high risk. I know that Janine, you're up, so I just want to mention two questions that are in the chat box that Janine, I hope that you could speak to, but also if our members on the call, if you wouldn't mind putting in the chat box. The two questions are, how many negative tests are you requiring of recovered COVID-19 patients before admitting to your nursing home or assisted living, either from a hospital or another long-term care setting? And then likewise, how many negative tests are you requiring of staff who tested positive before returning to work? So if you all wouldn't mind putting those answers in the chat box for me, I would appreciate it. Oh, here's another question that came in for you, Dee. How long should a community be COVID-19 free before reopening admissions?
Yes, and that's one that Dana sent over as well. And so in terms of assisted living, I looked through the different state websites as well, and I did not find anything specific from Department of Health or Social Services or even CDC. I did just pop in there for you what CDC does have on assisted living, but I haven't seen anything specific in terms of guidance on that. The best I think we can pull from is between the Department of Health and the Department of Social Services guidelines on how to handle it if somebody is in your community and has COVID-19. But I have not seen anything yet specific on that. It's something we'll definitely go back to and ask for guidance from CDC.
Great, thanks, Dee.
Thanks so much, Dee, and thank you, Janine, for joining us. Before we moved over to the nursing home update, I did want to mention, in the spirit of discussing reopenings, The adult days in our state are starting to look at that. And adult days are not included on any priority for PPE distributions. So I'm raising that just for thought. And if you have an adult day center that's in your area and you have PP resources, information, extra supplies, anything that you could do to help coordinate with your adult day center, that would be great, because within aging services, they are one of the first, I think, that will begin to reopen. So
Dana, if I could add one more thing, going out
yes.
in our daily update today will be a document, PS Salon and Spa, which is a national company that provides salon and spa services for members. They have released kind of their best thinking around reopening your salons and spas. So they're a gold partner of LeadingAge National. So we'll include that in our update today as well to help members start thinking about that.
Thanks, Melissa. So thank you, Janine, for joining us. If you could share your thoughts with us about any new information related to nursing homes, as well as the White House's recommendation on all testing of nursing home residents, your thoughts on that. So over to you.
Sure. Thank you, Dana. Thank you, everyone, for having me. And, I really just want to say that I know that it has been a really long battle, and we're still in the middle of it. And if there's something I don't answer or we get to the end of time, please feel free to reach out to either myself or to Jody. I know she's been on a lot of these calls, and she's got a lot of the nitty-gritty pieces that I might not have. But I did want to share today that on May 11th, CMS announced additional blanket waivers. And so, as you know, with the emergency declaration back from the president in March, blanket waivers have been put out through the last, 8 weeks. The blanket waivers that were released and put forth on May 11th, focused for nursing homes, the section on nursing homes, have to do with paid feeding assistance. And so the requirement was an 8-hour state-approved training course. Well, so with the new waiver, that is now being modified to a minimum of 1 hour. Now, obviously, with the waivers, as we've seen with other ones, there are caveats or pieces that you still need to follow. So when you go in and you actually are looking at the federal regs, always starting with 483, and this is in the 0.60 range for that, the paid feeding assistance, that the training has not been waived. So the training program still has to have required topics to be covered. And I think if I recall, when you're looking through it, it's infection control is one of them. But remember, it's just the requirements go from the state approved training courses from 8 hours to 1 hour. The other piece of this, that the feeding assistant still must work under the supervision of an RN, or if you in your organization use LPNs, which I know some places do not, but that is one of the waivers from the 11th. Another waiver falls under life safety code. Excuse me, I'm losing my voice a little bit. And having to do with the alcohol-based hand rubs or hand sanitizer. So knowing that with the life safety code, placement of those alcohol-based hand rub dispensers throughout your organization, with the allotment of space before, having to do with life safety code, obviously, in case they could trigger any fire or any sort of something against the life safety code, that they can be, those particular requirements have been waived. The prescriptive requirements for that have been waived. But what, again, another contingency back into it is that they have to be placed and stored in a manner that prevents ingestion or considers any fire risk associated. So anything over the 5 gallons. So those are the specific pieces of that, of the requirement for under the life safety code, but there is the waiving of the prescriptive part of the requirements around the placement. So that is under another waiver for life safety code. Another area under life safety code is something I think we've been asked since day one during COVID, having to do with the fire drills, and knowing that we always have gone back to CMS and they talk about the health and safety of the residents. But here, as of May 11th, CMS is waiving the requirement for quarterly fire drill, and they're looking at that regarding not just the safety but the social distancing concerns when it having to do those drills where staff is congregating, residents are congregating. And so what CMS is asking and what they're permitting is documented orientation programs related to the current fire plan. So obviously in your organization, you have a fire plan, you have a fire drill plan on what you do quarterly. As long as you're documenting that those physical environment operations, if anything has changed, you need to make sure those changes are in there, and that fire plan has gone and staff is instructed on what their current duties are. So again, looking back to what you're doing, so not actually having the drill, but making sure that you have the documentation of the training program for your current fire plan. The last waiver for nursing homes has to do under temporary construction. So any of the requirements that have to do with temporary walls or barriers between patients, knowing that they can now be used and they can be waived to have any environmental controls or physical environment modification. So if you're trying to cohort, if you're trying to isolate, those requirements have been waived under temporary construction. We've done a little bit of an overview of the waivers on an article through our website in the COVID section on the web page. And also, as I'm hoping everyone saw, we have a chart that we've been updating continuously as waivers have been announced. And this is at the top of that particular waiver. So I'm going to switch gears and I'm going to just talk briefly about the National Health Safety Network and the reporting. I know that this, I think between Jody and I, we get many emails and calls a day, and it's a frequent questions that have gone through on the daily calls that I hope that you as a member get a chance to be on. Yeah, there's been the memo that was released, the federal regulation was released, and the actual rule and the requirements. Facilities you have to gain access to the NHSN system using the enrollment process, and I'm going to talk a little bit about another call that Jody and I have today and what we've been advocating and really pushing and working for with CDC and CMS. But as a provider organization and knowing that it is a nursing homes that are certified Medicare and Medicaid, that is who has to report. And CMS's line that they use is that if you are on Nursing Home Compare, if your organization is on Nursing Home Compare, then you report into the system as a nursing home. The first set of data is set to be due by 11:59 p.m. on Sunday, May 17th, going back to the regulation that was actually posted on May 8th. So with that, I know at the top of the call, I've been on the call since the beginning, there was a discussion about assisted livings. Assisted livings don't fall into the category of what's required for the National Health Safety Network reporting system or the COVID module that they're using. But as I said, nursing homes are required. You know that throughout the memo it talks about there's 2 new F tags. And with those F tags, one is of just a federal site, the other could be a federal or state site, which could also lead to CMPs. What we've been hearing is that there are many members of LeadingAge and many nursing homes throughout the country that are having a very difficult time getting enrolled. The response rate, the response time back from the CDC or NHSN is a lot longer than what they are saying they're doing. And so we've been seeking the clarification on what they have been doing. Jody and I actually have a call today to put forth more concerns. We put them all in writing. We've been advocating, especially since the rule was posted on Friday. We understand that they're adding more workers that are on the back ends for the module. They've been adding more webs. There is one actually today in regarding to enrollment. So not just the Q&As that they've been having, but there is a 1 p.m. Call today with the NHSN. It's a webinar that's focused on the topic of the module and what you will learn about how to submit the data, the reporting pathway, and so forth. So I will make sure that I will send this, actually, I don't know if I can lift it into the chat, but I'll make sure that Dana, that you get it and that you can make sure it's out there for members. I think the other piece that with the reporting, there is the residents and families. when the memo was placed out, there was an FAQ attached to that. There are still questions that we don't have answered. We're seeking clarification on the cumulative updates. So knowing that if you're identifying residents and families of each case by 5 p.m. the next day, the format that your organization chooses. With that, if you don't have a new case within the week, you must provide a weekly update with that information. And you do need to report staff and resident cases. So just some kind of frequent questions that we've been getting. As I said, please feel free to make sure that if you have something and you have roadblocks, that you forward it into Jody and I, because we have been having a line of conversation with CDC and with CMS, but and we've been trying to bring all the challenges forward to see if there's any chance to get movement in the date of submission. Again, I don't have an answer for that, but I know that it's something that we've been asking. To switch gears again into the White House announcement that I know that the President Task Force, had with the governors for testing all nursing homes to be testing in the next 2 weeks. We see that this is problematic, and again, being on this call, hearing from all of you and from the speakers that tests are not available, and I also heard this morning on a call that the swabs are starting to not be as available to be able to do testing. What we've been advocating for and what we've been working on is, one, getting more tests and making those tests available to nursing homes so that you can comply with how this order is going to come forth through your governor. But we've been also working on the collection, and meaning on the billing side. There's been some questions that have come forward on as nursing homes are doing the testing. I know that there were some answers initially, but now, as we're getting into be testing more people, how that will actually work for billing. And then the other part, when we were on a call with CDC earlier this week, was that once you have the results, what is an organization going to do if you don't have the PPE, if you have people that are confirmed cases? And so we've been also pushing with FEMA and with the network itself that's trying to make sure that we have enough PPE. So I think that's everything that I have today to kind of report on. I don't know if there's any other questions, if I answered everything. I know, Melissa, you said initially there was a couple questions in the chat box, but I tried to scroll up.
Yeah, it was, Janine, I was asking the members how many negative tests they're requiring before readmitting residents from the hospital or from another long-term care provider, as well as how many negative tests they're requiring of staff before they return to work.
Oh, got it. Okay, great. And I know I've been seeing two within a particular time period. I will tell you, that's what we've seen from members throughout the country. But I can also focus to Jody if she's heard anything different.
That would be great. Thank you.
No problem. No problem. And I know it's 12 o'clock, but again, please feel free. I did post. I was able to post the updated waiver highlight level onto the chat, but I will forward right now to you, Dana, the email I received this morning from CDC about the webinar at 1 p.m. today. And then no problem. I do just want to close with I think everyone knows we are hand in hand working with CMS, and we have a weekly call with them on Wednesday evenings. Us and different other provider associations like American Healthcare Association, APAC, and AMDA, and so forth. And so that call tonight is actually moved, and the reason it's because there is always a CMS nursing home call today at 4:30. It's always Wednesday at 4:30. And it's usually 30 minutes. They've expanded that call today to 60 minutes. I don't know why. I just got an alert about it through our contacts at CMS. I don't know if there's something special that's going to be on the call or there's going to be an announcement. Your guess is as good as mine. But I did want to tell you that call at 4:30 is, my understanding is expanded till 5:30, not 5 p.m.
Well, I appreciate that, because we do send our members calendar invites for those calls. So I will extend that one for today. And the information that you send me, I'll also include in our update today. So thank you, Janine, for all this great information. We really do appreciate all that you're doing for us. So thank you so much. So that's everything for our call today. Our next call will be on Wednesday, May 20th at 11 a.m. And we'll look forward to speaking with everyone at that time. If you have specific issues that you'd like addressed on that call, please send those to me. And we just want you to know we're here for you, and you're in our thoughts and prayers. So thanks so much, everyone. Have a great day.